Hi, you guys. Welcome back for our daily practice questions. It is day 133 and day 3 of our Pharm series. But before we get into our questions for today, I always like to start with my introduction and disclaimer. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Long story short, I'm the answer to your board success. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, maintaining a 99% pass rate on all of my courses and a 100% pass rate on my one on one sessions. And I just want to take a brief moment to congratulate all of my recent review students on passing your boards. I am so, so proud of you. A few of y'all have been working with me some time, and we have worked through so many scenarios and all of the things that life will throw at you while you're trying to accomplish a goal. But I am so proud of you for pushing through and reaching your goal. I told you you can do it. You just have to believe in yourself. And I'm just proud of y'all. So congratulations. If y'all see the congratulation post, help me to congratulate everyone. They have worked so hard. But disclaimer before we get started, my disclaimer is that we know there's no absolutes in medicine. We treat on a patient by patient basis. And I just like to say that because all the questions that I design and create here, I do it based on the current guidelines that are being tested on the ANCC and AANP exam. And I say this on every video because I know what is done currently. So that's why my videos where I teach on things that we do currently in practice, I always say that. But when I am teaching you these questions, I am teaching you so that you are prepared for the current exam and the guidelines they are currently testing on. When they update, I always tell y'all. So I designed this so that you're prepared for what you're beginning to face, not what is currently being done in practice. And then when we are talking practice, I always tell y'all that so you can separate the two and be successful, as I always say, on boards as well as in practice. And y'all make sure y'all hit the subscribe button so you're not missing any of my videos. But let's get into question number 1 for today. Question number 1 states, what is the first line antibiotic for treating acute bacterial sinusitis in an adult without allergies or recent antibiotic use? Is it A, azithromycin? Is it B, amoxicillin, clavulanate, aka augmentin? Is it C, levofloxacin? Or is it D, doxycycline? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem is the question is the stem. What is the first line antibiotic for treating acute bacterial sinusitis in an adult without allergies or recent antibiotic use? And the best answer is B, is your augmentin, amoxicillin, and clavulanate, or it may say amoxicillin and clavulanic acid. This is augmentin, and that's your first line therapy for sinusitis. Question number 2. Which of the following presentations is most consistent with bacterial rather than viral sinusitis and warrants antibiotic therapy? Is it A, nasal congestion and headache for 3 days? Is it B, facial pain and nasal discharge improving after 5 days? Is it C, symptoms persisting without improvement for over 10 days? Or is it D, mild congestion with sore throat and cough for 2 days? Take a moment and tell me what you got in the comments, y'all. All right. Again, stem is the question. Question is the stem. It states which of the following presentations is most consistent with bacterial rather than viral sinusitis and warrants antibiotic therapy. So what is consistent with someone who may come into you that you would think is bacterial versus viral sinusitis and that you need to give antibiotics for? And your best answer is C. Anytime the symptoms begin to persist without any improvement over 10 days, you need to think bacterial, and they definitely need antibiotics for management, okay? And lastly, question number 3. A patient with acute bacterial sinusitis and a documented anaphylactic allergy to penicillin requires antibiotic therapy. Which of the following is the best option? Is it A, amoxicillin? Is it B, cefdinir? Is it C, azithromycin? Or is it D, amoxicillin clavulanate? Take a moment and tell me what you got. All right. So stemming the question here states, which of the following is the best option? All right, so the best option for what? Let's see what we're talking about. A patient with acute bacterial sinusitis and a documented anaphylactic allergy to penicillin requires antibiotic therapy. All right, so let's talk about this thing. First-line therapy for acute bacterial sinusitis is what? Augmentin, right? Or amoxicillin plus clavulanate, right? But this patient has an allergy to penicillin, and not just any allergy, but an anaphylactic allergy. So we're not given any form of penicillin in any shape, form, or fashion, right? We don't want those problems. So that means we can't give the augmentin. So then we're starting to look at our answer choices, right? Because we're working through how will we treat. Amoxicillin, we're not given that. It's penicillin, right? Cefdinir, what did I tell y'all on yesterday? The cephalosporins and penicillins, they're family, they're sisters, they're cousins. So if you got a problem with one, we got a problem with the other. So we don't want that, right? So we're not giving cefdinir. So your best answer is C, azithromycin. Azithromycin is a macrolide. Now, commonly for sinusitis, if you cannot have penicillin or if they have been treated on augmentin and they are needing additional therapy or haven't had any improvement, azithromycin is typically your alternative. So your best answer here is C, A, azithromycin. Remember, even in doubt, you need to be able to go through these because even if you did not know that azithromycin was the next best treatment option, you should have been able to rule out that one, we're not giving amoxicillin because it's a penicillin, right? Two, augmentin has penicillin components, so we're not going to give that. And remembering those cephalosporins are family, so we're not giving it to someone who has a severe penicillin allergy or an allergy that specifically states that they have an anaphylactic reaction secondary to it, okay? So make sure you pay attention to those key terms. Do not rush through these questions. Anytime they're asking you for a treatment, I always tell y'all to run it back and look and see if they provided you with a diagnosis. But you also want to make sure that you are identifying if there are any allergies, always, okay? Because that's going to be key when you are working through these things. But all right, you guys, I hope you found this helpful. We will be continuing on our Pharm series. So as always, be sure to like, comment, and subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel. If you go to the main page, you'll be able to see all of the links to all of the things and resources that are available. But as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.